Hi, ladies, it's Barbara, and I am your menopause drama mama. And I am always here to talk to you about everything and anything that happens to us after our or during our perimenopause years and all the way through postmenopause until the day we die. Today is all about vaginal atrophy. Um, there's a long medical term for it. Couldn't pronounce that if I wanted to. But it is the thinning, the drying, and inflammation of the vaginal tissue caused by low estrogen. So, when we start to lose our hormones, this happens to us. And it most commonly happens during perimenopause, after menopause, um, after a hysterectomy with ovary removal, and during long periods of low estrogen. So, when we had, our, our bodies producing the estrogen like we did in our younger years, what it did was it kept the tissue thick down there. It kept it elastic. It was very well lubricated. It was rich in healthy blood flow, and it protected the good bacteria down there. I was recently I was listening to Dr. Jen. I think she used to be on Good Morning America. Maybe she still is. I don't know. But she was talking to her daughter, and she asked her daughter, what was the number one thing that a gynecologist would tell their patient? And her daughter answered that it would be for women not to wear underwear when they go to bed. Now, I was never told this. The reasoning for it, now if you are uncomfortable doing that, you can wear like boxer shorts or, something very baggy, but not underwear, because that area alone, when it stays with a lot of moisture, what happens is more bacteria grows and you end up with more urinary tract infections, which I'm telling you, I have suffered from, I don't know, one or two times before, and they get very painful when not taken care of. So that is maybe a little tidbit of information for you if you do suffer from urinary tract infections. But so when the estrogen drops, your tissue becomes very thin and fragile down there. The natural lubrication decreases and the pH levels change down there, and your collagen declines also. The most common symptoms, if you may be suffering from this and you want to speak to a physician, is one, you could tell them you have vaginal dryness. These are the symptoms. So if you have any of these, then you may want to speak to your physician. You have burning or irritation. You have any itching. You have pain during sex. You have light bleeding after sex. You have frequent UTIs. You have a urinary urgency and bladder discomfort. Over 50% of postmenopausal women experience these symptoms. And if you are wondering if you are not on an HRT, is it reversible? Yes, it is. You can have a vaginal moisturizer. You can use vaginal estrogen, DHE inserts. There's an oral medication, and you can also do a pelvic floor therapy. Now, you can also have a vaginal estrogen cream, a vaginal tablet, or a vaginal ring also to help with this issue. And when it is corrected, you will restore your tissue thickness. You will restore and improve the lubrication. It'll reduce your UTIs. It'll help with urinary urgency, and it will have a minimal systemic absorption in your body. So that is with the estrogen down there. Because if you do an HRT, like the patch that I have, estradiol, that's a whole body. But if you aren't looking for a whole body and you just need to protect down there, then you'd want the estrogen cream. And most Gynecologists recommend this first because it works directly on the tissue. It uses a very low dose, and it has very strong safety data attached to it. So, if you are experiencing any of these symptoms, I would talk to your physician and see if they can help you out. And maybe you can get a vaginal estrogen cream to help with the issue. So anyway, ladies, wrapping up my video as usual. Love you. Big hugs. I am sending positive vibes your way. And may you have a fantastic day wherever you are in this world. I will see you in my next video. And please click the like if you did like my video, and subscribe to my channel if you haven't already. Take care, ladies. Bye-bye.